Good afternoon everyone, and welcome to this webinar which is about the evidence for the strengths and asset-based approaches in social work practice. We're really pleased to see so many of you logging in, and we'd like to thank you for taking time out of your busy day to take part. As you may have seen, there's a chat box for you to write your comments and questions in. Just bear in mind that everyone else taking part in the webinar will see what you type, and the webinar is being recorded. The slides and recordings of the webinar, including your comments, will be available for you to view in a few days' time on the NICE and SCIE websites, so you don't need to worry about taking notes. And at the end of the slides, we've included links to all the references in the webinar. So we'll start by introducing ourselves to you. My name is Charlotte Goulding. I'm the Social Care Policy and Practice Support Manager at NICE, and I'm a social worker. Before working for NICE, I worked in various social work teams, including supporting adults with learning disabilities, hospital social work and safeguarding. I'm really pleased to be joined by two other social workers who are really passionate about strengths-based approaches in social work, so I'll let themselves introduce them to you.
Hi, afternoon everybody. My name's Samantha Barron. I'm a professor in social work at Manchester Metropolitan University.
Hi, my name's Rebecca Spurrell. I'm a qualified social worker and my role is professional lead at Cheshire East.
So the objectives of the webinar are to learn about the evidence in NICE guidance for strengths and asset-based outcomes and how this was used to develop a quick guide for social workers, to learn about the role of research in the development of strengths and asset-based approaches in social work, to learn about different models of practice, and to learn about using strengths and asset-based approaches in social work practice. So I'm going to go through the first section, and then Sam is going to go through the next 2 points about research and models of practice, and Rebecca then is going to talk about what this all means in day-to-day frontline practice. And we're going to have questions at the end, so do feel free to be adding your comments, because we'll be looking forward to speaking to you at the last kind of 10 minutes. So I'm going to start off with going through the evidence for strengths and asset-based outcomes and explaining how the NICE Quick Guide was developed. So when I speak to social workers about NICE, most people who I speak to do know about NICE, but they associate NICE with medication and health. So I just wanted to start off by pointing out that from April 2013, NICE was given a new remit to develop social care guidance, and it was renamed National Institute for Health and Care Excellence. So NICE guidance is absolutely based on evidence. It sets out what good care and support looks like. It's a what works centre, so it explains what's good value for money. It's based on the right principles and ethics and looks at equality. And it's a trusted source of information. So it could be very helpful in integrated teams to really explain your role and to explain why you're doing certain approaches. So how does NICE develop evidence-based guidance? It's an extremely robust process. So there's a systematic review of evidence, and there are committees who look at the evidence and decide what the recommendations should be for guidelines. And I wanted to point out that the committees do involve experts by experience as well as experts by practice. So an example of that, one of the key guidelines that was used to develop the quick guide for strengths-based practice was people's experience of adult social care services. And in the committee for that guideline, there are 16 committee members. There are 6 of them who were people with experience, 2 of them were carers, and the remaining members were practitioners. So the guideline in NICE is a set of detailed recommendations about a certain topic, and a quality standard is when we look at what particular areas from that guideline would help in service improvement and service development. And the purpose of all of NICE guidance is to improve outcomes for people. So why do we need evidence for strengths and asset-based approaches? Well, it's very clear in the Care Act that we need to move towards working with people's strengths, to recognising their assets, to thinking about their networks, and also to thinking about what's in their local community, what voluntary groups and community groups could we help people connect with. And it's very clearly outlined in our Chief Social Worker Officer's report that the number one priority for this year was to embed strengths-based social work practice. Now, when Sam and I have been talking about strengths-based practice, we have had discussions that one of the critiques of this practice has been that there's a lack of evidence, and that's what really led us to developing the Quick Guide. But I thought it might be helpful for Sam just to explain a little bit about her knowledge of why there's a lack of evidence base.
Yeah, I think really, and it's interesting just watching the people who are on the chat. There are a couple of people on the chat, Colin Slasberg and also Alison Milne, who might want to come in at this point, that actually strength-based approaches is quite a conceptual term, actually. It's a bit like the word partnership. It kind of appeals to anybody working in health and care sectors, but actually we know a little bit about it, but we also know not a lot about it. And the lack of evidence in this area is the bit that we need to build up professionally, because we know that so many organisations are moving in the direction of working in strength-based working.
Thank you, Sam. And another thing that we need to consider as social workers, with our new regulator being Social Work England, is that we'll need to follow the standards that Social Work England has set out, and some of those are about considering how we use evidence to inform our decision-making process. So I don't know how many of you have actually seen the Quick Guide, but on the left is the image of what the Quick Guide looks like. And we've put a hyperlink in there to the Quick Guide, so if you did want to have a look at it, that's one way of accessing it. And within the Quick Guide, we really cover three broad areas: how to work with someone's personal strengths and assets, how to think about their community strengths and assets, and then the final section is about supporting people to shape their communities, and that's really thinking about co-production. So when we started to develop the Quick Guide, we had a look at three main guidelines from NICE. So the text that's in hyperlinks is the titles of the guidelines. At NICE, we often refer to the guideline by a number, so where you see NG86, that's how we often abbreviate it. So the main guideline that we used to inform this Quick Guide was people's experience in adult social care services, and that's very aligned to the Care Act. So it talks a lot about involving people in their decisions, about thinking about their strengths, and also about co-production. The next guideline that we referred to was community engagement, improving health and well-being and reducing health inequalities, and also the quality standard that was linked to that. And that very much talked about working with the whole of the community, thinking about the assets, and making sure that as practitioners we were knowledgeable about what was available in our local communities. And the last guideline that we thought about was transition between inpatient mental health settings and community or care home settings. And the reason why we looked at that guideline is that it had particular recommendations about connecting people with their home communities when they're in mental health admissions. The other part of us developing a Quick Guide is to consult with an advisory group to make sure that the messages in the Quick Guide are aligned to the guidance, but also to make sure that the messages sync with what's happening in your practice and other current policies. So when we're developing a Quick Guide advisory group, we ask to have a range of people involved, a few people who've been involved from the Quick Guide, from the guidelines. So Jonathan Kilworth, you can see there, and he was involved with people's experience of adult social care services. It's also really important that we have experts by experience involved. So we had Kath Sutherland, Cash, who was involved to represent people with lived experience. I do want to just say at this point that we had very sad news recently that Kath has passed away. So on behalf of NICE and SCIE, I do want to offer condolences to all of Kath's family and friends. And there is a tribute page on the SCIE website which really recognises the work that she did with SCIE in co-production. And Kath also did a lot of great work with NICE on a number of guidelines and quality standards. We were also keen that the advisory group represented organisations that might work with local communities. So Lynn Bowers represented local community support, and Jonathan Holmes, at the time of the quick guide, he was working for Health Watch. And because this quick guide was for social workers, we felt it was really important that it reflected current issues in social work practice and a range of different social worker perspectives. So that's why we had Sam and Rebecca involved, and also Julie Bootle and Andrew Errington. Now, I understand that Julie and Rebecca both also liaise with social workers in their local area, and I thought it might be helpful just to hear a bit from Rebecca about what their comments were and how that worked.
Yeah. Yes, I spoke to a couple of our social workers that are based in our first point of contact team. I'll talk more in my section later about that contact team and how they work to help sort of support the strength-based approach. So yes, the two social workers, Taffy and Sharon, both sort of looked at the guide and were able to offer feedback that related to their present working about how they work and sort of identify people's strengths and look at the community resources. So yeah, they were really keen to give their feedback to Charlotte and sort of have an input from the workers, you know, the social workers that were actually doing the job at the front door.
Thank you. So thank you on behalf of NICE and SCIE for everyone that was involved in the development of the quick guide. We really appreciated everyone's comments and feedback. Just the other thing to say about the Quick Guide Advisory Group is that we were very keen when we developed this webinar to make sure there was practical focus. So I asked if people could send any examples that they had from their local area about different policies of working with strengths-based practice. And Julie Bootle from Leeds and Andrew from Coventry have sent their guides, and we've got links to that at the end of the webinar slides. And also, Julie sent through the template that is used in Leeds. They've moved away from a 26-page assessment to a conversation record, which is just 3 pages. So the template is linked. So the first section of the quick guide is about personal strengths and assets. So this covers thinking about working with a person in a person-centred conversation to build a picture of their strengths, their preferences, their aspirations and needs, providing any support needed to enable the person to express their views and take part in conversations, including independent advocacy, involving the person's wider social network, such as the carers, the family, friends and advocates, and thinking about the support that might offer, sharing information so that the person feels informed about their care and support, so they're aware of other issues, financial advice, safeguarding procedures, their rights and entitlements, and how to make a complaint and personal budgets. Thinking about how to promote positive risk-taking and how to support someone if that helps them achieve their goals, and promoting the person's interests and independence through contingency planning and crisis planning. So I'm going to go through an example of how we looked at the evidence behind this and how NICE develops the guidance. So the example I'm going to show is the one that's highlighted, provide any support needed to enable the person to express their views. So that particular recommendation came from this guideline, People's Experience in Adult Social Care Services. And this slide shows you what the NICE website looks like if you wanted to look into the full guideline, and there you can see the recommendation. There was a lot more detail in that recommendation, so if you did want to have a look at it, you could go onto the website. So NICE has a very transparent process when it's collating all the information for the guidelines. You can have a look at all of the committee meeting minutes. Everything that has been done and appraised is all on the website. So if you wanted to have a look at the information behind that recommendation, you go into the full guideline, so that's the first link that we've circled, and you would look for that recommendation, and that would tell you what evidence is linked to it. And then the next circle, the evidence tables, goes into a lot more detail and shows how all the committee members have appraised the different evidence and come up with a recommendation. So in terms of what we were talking about, these were all the different evidences that were collected for that recommendation. So there were 3 qualitative studies about the views of people with learning disabilities regarding service provision. 1 study about satisfaction with social care services among Black and minority ethnic populations. A mixed method study about time limits to advocacy interviews being a barrier to delivering person-centred care. And then when the guideline went out in its draft format and there was a consultation, there was a lot of feedback from stakeholders about making sure that we included the accessible information standard. So the guideline committee considered all that different type of evidence and feedback, and they came up with a recommendation as we saw. So this is the next part of the quick guide, thinking about working with community strengths and assets. It's quite a long part of the quick guide. There are 8 recommendations that are included in it, and I've just put the first 3 on here just to give you a flavour. So the first point about using your own knowledge, networks and relationships to help identify assets and facilities within the local community. And this is something, again, that Sam and Rebecca and I have talked about. I know it's come up in the feedback that Rebecca got from local care, social care practitioners in Cheshire East. And I think, Sam, when we've talked about strengths-based practice, we've talked about a social worker using their own knowledge and their own skills. I don't know whether either of you want to say any more about that at this stage? Okay.
I think it is one of the most key points to it, really, and for us, I think, or for me personally, I found the community strengths and assets, it's sort of key to keeping everything together, and it's sort of the starting point I found in practice that we've had sometimes in some of our areas, because if you don't know your community strengths and that sort of assets, it's hard to then develop that network for a person that you're working with.
Thank you. So the last point on there was about supporting people with mental health issues to maintain links with their home community. I'm just conscious of the time. What I've done in the slides is explained again how we've come to that recommendation. So this is the guideline that recommendation comes from, and these are all the different levels of evidence that were included to make that recommendation. I thought that was a really important point because I think a lot of us have seen Walton Hall, the Panorama episode, and I think there's been collectively a lot of concerns about, as social workers, what can we do to support people who are in long-term mental health placements. And that recommendation really shows the importance of us trying to link people with their home communities and supporting them to have information about what's going on in their local community. The last part of the quick guide is about supporting people to shape their communities, and that's very much about co-production. So how do we work with people to produce information? How do we help them to recruit staff? How do they shape individual services? And how do we use feedback from the people that we work with to inform services? And then we asked the quick guide members if they had any feedback about how the quick guide could be used in practice and how it could help with social work practice. So in Kath's quote here, she was very much explaining how helpful it could be for the people that we work with, really to help them achieve what they want. And then in Lynn's quote, she's really explaining in her quote how helpful it could be for social workers to empower them and really go back to their managers and say that this approach is really helpful. And in Julie's quote, she's explaining that perhaps it can help with us working in health settings with health colleagues to say that strengths-based approaches based on evidence in this quick guide, it is something that is helpful and hopefully it might promote integrated working. So I'm going to hand over to Sam now, who's going to talk about the research and models of strengths-based social work.
Okay, thanks very much for that, Charlotte. And just before we move on, we're just trying to pick up some of the questions as we go along, and there's one question that I think relates to from Paula about how quick guides are developed. I don't know if you could answer it, Charlotte. It was about how do you include minority and ethnic communities in the development of quick guides?
Well, I think that when we're developing quick guides, we always try and get a range of different people to be involved. To be honest, sometimes we do struggle to get volunteers. So if people have got ideas about who we should contact to make sure that we are thinking about different groups, and that would be really helpful feedback for us. We're going to be developing a quick guide on social work with people with autism, and a quick guide on social work with people with domestic violence. So we were always looking for volunteers to be involved. So perhaps that's something we can talk a bit about more afterwards.
Okay, thank you. So just moving on then. So if we begin to look at strength-based working, myself and Tony Stanley, who was a principal social worker and has now relocated himself to New Zealand, how lucky is that, started to develop the idea of doing a practice framework for social work, actually, and in order to encourage practitioners to be quite theoretically minded and evidence in terms of what they do around strength-based working. So we developed a practice framework, which I'm going to show you a little bit later in the slides. It then got turned into a strength-based practice framework, which was a little bit different from what was originally anticipated. And it then kind of drew mine and Tony's mind to thinking, well, what does strength-based working actually mean? We are both social workers, so we both, as Colin has written actually on some of the comments, actually, that it is something that actually appeals to most professionals, the idea that you're going to focus on strengths, but what does it actually mean? And for me particularly, I was quite keen in exploring the idea of strength-based working, and that it didn't become systemised in an organisational way that just replaced care management for social work, that it had to mean more than that. So when I started looking at this work, I think the first slide shows you it's a bit of a terminological quagmire, because the words strengths, assets and well-being, capability and capacity are often used interchangeably, and I've just done a piece of work on this around how you differentiate between the two, because I think there are differences, and whilst there are areas that complement each other, we've got to be really clear about what we're working on and why we're working on them in a particular kind of way. So that was my starting point about what's the difference between those. Now, in essence, strength-based work actually has its roots in philosophy and philosophical theory, which you can imagine is quite dense to read, would be the word, around that. But I did start reading that, some of the philosophical theory, some of the work around Aristotle and Kant in particular, who talks about the right to self-determination and the right for freedom and autonomy, and that's in essence where it comes from. But the quote that you're looking at now is from some of the work of Dennis Selby, and Dennis Selby was an American professor who actually then developed the idea of strength-based working from some of the philosophy that he'd looked at. And it's probably Selby's work that has brought strength-based work to the prominence in the UK and as a policy initiative actually within the UK. So he believes fundamentally that all human beings have the urge to be heroic. And by heroic, it actually means the sense of wanting to be known for something or to achieve something. And in some of the training I've done around the practice framework, it's often a question I ask people actually, what do you want to be known for? What would be heroic for you? And it's often quite a good starting point, that. So for me personally, to be heroic is to be a good parent, actually, to be a good mum. That's by far my number one. And obviously for anybody out there who's a parent, you can imagine that's a bit of a day-to-day experience as to whether I actually achieve that. But that's where the starting comes from. What do we as individuals want to be known for? What do we want to achieve in our lives? And combine that with the fact that actually, as a human being, you can transcend quite difficult circumstances and actually overcome adversity. And the bit about Selby's quote about to stand up and be counted, that relates to some of the philosophical theory that actually we all have a sense that we want to be accountable in society as part of our individual development. And in philosophical theory, that's known as the virtues, about standing up to be counted in terms of the virtues that are important to you, that are linked to why you want to be heroic and what you want to achieve. So quite a bit of a complicated picture in terms of where the theory comes from. And if I can just switch over to the next slide, just shows you a little bit about Aristotle's work about freedom, self-determination, responsibility. And it's known as human flourishing. And it's a Greek word called eudaimonia. And I can't begin to tell you how long it's taken me to be able to pronounce that word in public, eudaimonia. And if you see the quote that's on the slide, that's a quote that was taken very early on about eudaimonia and the philosophy of eudaimonia. And you can see it's taken quite on because it's quite a gendered quote, actually, just mentions his. But it begins to say that actually eudaimonia is about a person taking charge of their own life so that they can develop and maintain their own life in a virtuous way that's important to them. And it's that idea of philosophical virtues. And importantly, if a person is to flourish in terms of human flourishing and eudaimonia, then they must be able to direct, i.e. self-determine what's important to them in their direction of travel. So we know that that strength, the idea of strength, comes from philosophical theory in Aristotle's work. There is a little bit more attached to it, which is around Kant's work. And Kant's work talks about order and duty, and that actually most human flourishing also is aligned to some sense of duty that we have as individuals. So in essence, the eudaimonia is about people should strive to reach their potential through the exercise of their capabilities and, importantly, through their reason and intellect. It grounds ethics in human nature and likens human flourishing to the virtues. And it's only by living a virtuous life that human beings can actualise their true nature. Now, in a simplistic form, which is a theoretical form, that actually sounds very attractive, I think, to many of us who work in health and social care. It's only as it gets a little bit more complicated when you think about the situations that we work in health and social care. So Alison Mill posted a question before, as did Karen from Durham, about the more complex end of the work that we are doing increasingly, and actually how do you begin to apply this philosophical notion of eudaimonia to working with very, very complex areas. So I think it's fair to say, if we can just, if I could just go to the next slide after that, that what Dennis Selby then went on to develop was some practice considerations, which he kind of defines as practice assumptions and as philosophical assumptions that underpin what is quite a complex theoretical position. So number one is that people are doing amazingly well and the best they can at any given time, and the difficulties they face, given the difficulties that they face. And I think that's a belief that and a value that we would all adhere to in working across health and social care. The second one is that people have survived to this point, not without hope, without pain, but actually through that process of survival, they've survived with a sense of hope, a sense of ideas, and some skills about how they've gone through quite difficult circumstances. And that one for me is quite an interesting one in the sense that it begins to change practice away from being problematised to one that is a little bit more strength focused, where you begin to work with people and say, well, actually you have survived through very difficult circumstances, and what skills and what ideas and what hopes actually helped you through that process. And that idea of survival, if you look at some of Dennis Selby's work, the idea of survival is quite a key bit to strength-based working, that we can survive through difficult circumstances, but what is it that helps us survive through those difficult circumstances? And the third one, I think, is just an absolute given around a philosophical assumption that actually that change will happen when we collaborate with people's aspirations, perceptions and strengths, and that we absolutely firmly believe in those. And I think, again, most people who'd be on this webinar would 100% agree with that. What's really interesting in some of the training work that I've done to date is that's the one that actually is more challenged when you do some kind of case study work in the training, because what I'm finding through the work I've done is that people revert back to organisational policy and procedure about what should be done, as opposed to having a firm belief in where that person wants to self-determine their own life and the future of where it goes. So the fourth one is about that people who face difficult circumstances can develop their own capacity and develop ideas and strategies that ultimately benefit them. And I think as a starting point, that philosophically and from a practice perspective is a hugely important starting point. But it's one which I think is quite complex in the area that we work with. And it goes back to the question that Karen asked, that Alison asked, that Colin's asking. We've got Rebecca in the studio here and she's nodding, going, yes, that is the complex area. And I think it's something for us to do more work on, because this issue of capacity and self-determination at the very high levels of risk, it is quite a complex area for a lot of us. Fifth area is that human beings have an innate capacity for healthy and efficient self-mentoring. And by that, that's actually self-regulation. That there's a philosophical belief within strength-based working that we will all self-regulate to a greater or lesser degree. Now, again, that's quite challenging in people who have high-risk needs or are exceptionally vulnerable. But the fact that they have survived through difficult circumstances suggests some element of self-regulation. And our work as practitioners is to find out what that self-regulation involves, what the skills and what the strengths were of that process. And then the last one, which is a quite strangely worded term really from Selby, is about maladaptive practices can be transformed into positive strategies. So it's in essence saying that when we go through difficult circumstances, we might develop negative behaviours, which in turn though might be part of our survival. And the key is to understand actually if that is part of our survival and whether those negative behavioural patterns we get involved in may protect us, may help us survive, or in fact actually increase the risk and go forward. But just in terms of, before we just move forward to the practice framework, so when Tony and I developed the practice framework, which I'm going to share with you in a minute, we started looking at this strength-based work and obviously looked at the philosophy, looked at the theory that underpins that, looked at some practice considerations for practitioners working in a strength-based way and some of the complexities of that. But what there is out there, and I think it's quite important, is a whole body of knowledge and evidence that is quite critical of strength-based working. And I think what we've got to do is to begin to look at the evidence that sits out there. And Alison Mill, who's on this webinar, and I have been in a meeting this morning talking about how we actually get that evidence together and how we then begin to draw it together, learn from it, but importantly share that with practice and practitioners about what is working and what doesn't work in terms of what the evidence and research then says. So moving us on to the practice framework. The practice framework was something that Tony and I did following a roundtable event with Lynn Romeo, where she brought together a number of presenters looking at strength-based working, and they were things like the ABC model, an ASIC model, strength-based systems change, relational practice, restorative practice. And at the end of that, there were really interesting presentations, and each of those approaches certainly has something to offer strength-based working. But my concern was, having been in management at the time of care management, was that, that if we just use this quite nebulous conceptual term and bring it into local authorities, organisations and into professional practice, it was in danger of just becoming another model, another approach that would be systemised to the way in which care management is systemised, where you actually end up where practitioners make decisions and their practice is based on organisational policy and procedure, as opposed to a body of knowledge and evidence what actually works under this term called strength-based work. So Tony and I suggested to Lynn Romeo, the Chief Social Worker for Adults, that we should look at developing a practice framework, which is what you can see on the slide now. And for those of you who know Lynn Romeo or have met her, she usually, when you make an offer, she goes, yes, thank you very much. So practice framework, what is a practice framework? So a practice framework is something that integrates research, practice theories, methods, ethical principles and experiential knowledge in a compact and convenient way. And practice frameworks are not new, they are very well established. In social work, they're perhaps a little bit more established in children and families work than they are with adults. But most professions work to a practice framework of some sort. The term itself is often up to debate. But we know from the adult social work world that we wanted to have a practice framework that would allow practitioners to begin to think about, what is this term strength-based work? What's it based on? What's the models that are used under that framework? How can we use strength-based models to actually improve practice? And how can we begin to make our decision-making explicit? And what is that decision-making based on? Is it just based on agency, policy and procedure? Or is it based on the research and evidence? So the practice framework that we've developed here builds upon the work of Tony Stanley, where it's clear that a practice framework has to have 5 domains, and you will see this across the literature and research. across many different professions. So it has to have a domain of knowledge and research on it. We added into ours co-creation because we felt that A, reflected social work, but it also reflected the core principles of the Care Act. We know that a practice framework has to have has to have theories and methods as part of the framework. There has to be values and ethics. There has to be a level of experiential learning, and there also has to be a level of skill development in any practice framework. You'll see that values and ethics is highlighted as a slightly bigger circle, and that's because this framework was developed specifically for social work, but it's not exclusive to social work. It can definitely be used with other professions, but values and ethics are what Tony and I felt actually defined social work as a profession, which is why we put it as central and has put it as a little bit bigger. So this framework is actually in a Department of Health and Social Care handbook, which you can go onto the Department of Health and Social Care website and actually download the whole framework and also the handbook that comes attached to the framework. But in essence, what we're saying is that for adult practice in a strength-based way, predominantly with social work, but not necessarily exclusively so, that if we have an overarching practice framework that encourages professionals and practitioners to begin to look at what is the knowledge and research and evidence and co-created knowledge that comprises their practice and also comprises strength-based work, what's the theoretical and methodological approaches that are used within strength-based work, what are the values and ethics that are required when working in strength-based work, what's the experiential learning of professionals so that we can get the knowledge and the practice experience that professionals bring through working every day with vulnerable people, and what are the skills required to work in this way, and what the skill development required of practitioners. What we didn't do in the framework is begin to define those a little bit further than those 5 domains, because we felt that was very much for practitioners to do, but also agencies to do. But the second piece of work that we've then got attached to that is, if that's the overarching framework, then where do all these strength-based models fit within the framework? Because the framework is an overarching framework. It sits as a process to enable practitioners to identify and make explicit what their practice is based on. But actually, if we're looking at theoretical models and also methodological approaches, what are they? So myself and a colleague, and actually we've since found out from the meeting this morning that there are 3 areas in the UK that are looking at this piece of work, where we're beginning to say there's a list out there that we know of about 30 models that are actually aligned to or make claims to working in a strength-based way. And what you see on the slide at the moment is an example of some of them. So what I've started to do, and I'm hoping to do this with Alison Mill and also some people from Exeter University, is begin to go through each of those methods and each of those models and say, okay then, well, what have they got to offer in terms of the research and the evidence? What have they got to offer in terms of skills? What have they got to offer in terms of values and ethics? And what do they offer in terms of experiential learning? That's quite a big piece of work I've just described in that small sentence there. So how it relates to the practice framework is, so if you look at the 5, I think they're blue or purple circles, you'll see that each of the 5 domains of the practice framework are highlighted. If I take a couple of examples, so if I take 3 conversations, which is one model that I think is used quite extensively. Now, a lot of organisations have brought 3 conversations into their organisation, or they've adapted it and used it and called it something else, but they've used the main principles of it. But if you look closely at 3 conversations, you'll see that actually it's very strong on values and ethics. It has a knowledge base to some degree. In terms of research, as I know research to be, there are some limitations to that research, although the organisation delivering 3 conversations has done its own evaluation, and I know that quite a lot of organisations have started looking at some evaluation. In terms of what a methodological and a theoretical approach would constitute, I would say at this moment in time that it's perhaps not quite there, that 3 conversations isn't quite there, but we do know it's high on skill development, and we do know that it's high on experiential learning. So what we're hoping to do is go through each of these different models that are associated with strength-based working, and then to begin to say, where are they strong on knowledge and research, where are they less strong? The idea isn't really to say this is the model or this is a really weak model. The idea is to equip practitioners with a greater detailed understanding of each of those particular models, so that when they're working in practice, they know which model they're working with, what the strengths of it are, and how to apply it in different situations with different people.
Thank you very much, Sam. That was really fascinating and really great that there's so much research going on. So we're going to move on to Rebecca now, who's really going to give us some practice perspectives. So great that you're all still engaged with what we're talking about, and thank you very much, Daniel, for sending in some links. They're really helpful. So after Rebecca's slot, we're going to have 10 minutes of questions. So if you could start thinking about any comments and any queries that you'd like us to respond to, that would be great.
Hi, I'll just get organised. As I said before, hello everybody, I'm Rebecca Squirrell, I'm professional lead in Cheshire East. So I've I can see our slide, it does say our Cheshire East journey, this first slide. So as I say, as Sam said, there's lots of local authorities that are looking at this and, changing their approach. Obviously for us, it really first started with our Cheshire East plan, which is what I put up there about the strategic outcomes. So it's embedded from the top, and we felt that it had to be a joined up approach within the local authority, not just isolated into one area. So as you can see, that is our strategic approach, and we're looking at the different outcomes and the different areas. And one big area, which links to what Charlotte was talking about earlier, is about the co-production. So it was about looking at that, how we can do it as a whole local authority and link everything together. Cheshire East is a very diverse local authority. We geographically, we're a very large local authority. We have some very affluent areas, some real pockets of deprivation, and some very isolated rural parts of the county. So we have a lot to look at, and a population that is extremely varied. So as a local authority, we with the change of the Care Act, we acknowledged that how we delivered our service and how it was within adult social care had to change. So this is our steps showing it was a bit of a journey. We have been up some steps, and we're nowhere near at the end of the journey. We've got a long way to go. But these are some of the changes that we did make in the beginning to try and look at how we're going to change this approach. So we looked at our community teams, and that was one of the biggest changes. We changed all the teams. So the teams are now aligned to the GPs. They're much smaller teams. We now have 8 community teams across the locality, plus first point of contact teams, and then obviously we have a short-term teams in the hospitals. We have the integrated mental health teams. We also have continuing healthcare teams, and then learning disability teams. But one of the other changes we made was we changed our occupational therapy service, so now the occupational therapy service isn't a standalone. They're in with the community team. So the occupational therapists work alongside the social workers within all the teams. And then we also changed the first point of contact. So we have 2 contact teams within our local authority, one in the east, one in the south. And then we also have a Live Well, which is an online resource, and that's a resource that can be accessed by any member of the public, which helps signpost to all different resources, health issues, and there's links to lots of different resources out there. And we also, within Cheshire East, have local area coordinators. So the local area coordinators are workers that then work alongside the teams, but their link is with the communities. They know what's going on, they know the the pubs that have the luncheon clubs and all things like that. And we found that because not everybody knows and can know their local area, whereas they can be the voice to sort of say, well, actually on a Tuesday in this rural village hall they run a coffee morning that everybody can go to, or they have a lunch club, or they have a reading club, or so there's lots of, they can be the sort of local knowledge for the social workers. So as I said, one of the big changes was our first point of contact teams, and they sort of started their approach using this real strength-based approaches, and their main aim is to sort of reduce and delay the need for long-term services. So to say, we've put a lot of resources in the first point of contact. There's people answering the phones, you know, who are trained staff. They're not just a call centre, and they're there to help signpost people, support people. There's occupational therapists, there's social workers, and there's links to the communities, so that they are sort of working as a whole. And even though, you know, sort of the referrals perhaps have gone up within that team, the support there has then sort of delayed the need for long-term services to later on. So, as we say, it's about reflection and research there, you know, what we did at the beginning. You know, we acknowledged that other authorities were doing this, so the manager of this team did go to Barnet and Trafford to have conversations with other local authorities to see what's worked, so we can share all of our learning between us all, so we can sort of get it right for the people that we're working with. And as I say, they are working really well. There's still development, we're still developing them and seeing what works, but we have found as a local authority this has been a valuable change and a valuable support for the strength-based approach. So these, the next couple of slides, I'm just very conscious of the time, are two case studies, and I know case studies are very sort of hard sometimes to see because you only get a snippet of what's gone on, but we sort of wanted to put in two case studies just so that you had a quick flavour of how we then also linked it to the quick guide. So you can see with this case study we linked it to finding about her personal strength. This was a lady who sort of was put into 24-hour care after her husband had passed away, and she had capacity but she had very high needs, but for her it was really important that she went home even though the risks were high. And so for this worker, they did work sort of with health, with the home, with the family, and she did return home. It wasn't for the whole, you know, she didn't stay there. Unfortunately, she did move back into 24-hour care, but it was her that made that decision, and I think that's what was really important in this case study. So, as I say, I won't go through these in detail because it is nearly 10 to, and if anybody has any questions at the end, we wanted to leave some time. And again, the second case study was around looking at supporting a carer and obviously seeing the values of the carer. For us, it was about our Live Well service, and we have a fund as well to help support the carers to sort of access different things within the community. And then it was about him being seen as an individual and being supported. So even though the person, it was his mother, didn't actually have a long-term services, he was able to then sustain that role because he was supported as a carer. Oh, I was nearly using the microphone. So this has been some of the feedback that we've had from people that have used services since we've changed the way we've worked. And as you can see, you know, like I'm sure all of you do get positive feedback. It isn't often, you know, as we know within the local authority, we get far more people come back to us when things go wrong. So it is about sort of valuing that positive feedback when we've got it. But as you can see on the last comment, it was just thanking them to help. So a worker just went out and supported, it was a son, to go through the online resource. So even though it was low level, but the worker went out, spent a bit of time, showed him how to access everything, showed him the way round it. So that then meant that he felt confident to be able to get all that information himself, for his elderly parents. So we sort of recognise it is that prevention and sort of identifying those different needs to be able to support the individual. Oh. This has come from our social workers. These are sort of top tips from the social workers. And as you can see, it's, you know, I'm sure a lot of you sort of work in this way. We tried to sort of keep it as the do's, but the first one was, you know, don't consider social work to be a process, because we have spent a lot of years care managing, going out, assessing, doing a support plan, and then putting on review and going round a process. So we now sort of are really encouraging workers to sort of think creatively, look outside the box, spend a bit of time, and as a worker you are a resource, and remembering that, you know, and that's what I think has been one of the biggest tips from the social workers, to remember that you are the resource as well as if you put a service in. It's not about always putting services in. And as I say, I won't read through all of the notes because we've got some time for the questions, because you will all be sent out the link and obviously the recording, so you'll be able to read those tips that came from, as I say, social workers who work in the front line and in the community teams. So, as I've said at the beginning, Cheshire East isn't unique. We are on a journey. We are sort of part of the national pilot with Sam, looking at the strength-based framework. So it's about embedding that within our practice of all of our social workers. And we, as a local authority, have decided not to pilot it in one area. We are doing it across the board. So I know a couple of you have asked about the complex cases and learning disabilities, which is why we as a local authority have decided to do it for all the teams, so that, and recognising that we are going to have challenges in the hospital team. It is more difficult because you've got pressures of the bed managers and the pressures of the beds, but we sort of feel that we need to be having this offer across the board. So yes, it's a journey that we're moving through. So sorry for the quick whistle-stop tour, but as I say, the slides will be sent out to you. So I'll just pass to Charlotte now.
Thank you very much, Rebecca. That was really interesting to hear about Cheshire East journey and some practice perspectives. So we're sorry that we're kind of running quite close to the end of time, but perhaps we can take a few questions. We've had a couple of questions about, as local authorities, what would be helpful in terms of collecting information which then can be used to research. So perhaps, Sam, I don't know if you've got any thoughts on that?
Yeah, I think, is it, I can't remember who it is.
Is it Natalia?
Natalia's mentioned it, about having, building a local evidence base. So, I mean, obviously in classic academic way, I'm going to say what's a local evidence base. So I'm not sure whether you are focusing on the outcomes for people or the evidence around assets, or actually whether it's about professional evidence. And as an example, a piece of work that I'm doing with one local authority is to try and increase the knowledge base of practitioners, both qualified practitioners, social workers, OTs, physios, and unqualified, unregulated workers, to begin to look at what their evidence base is around the decisions that they're making. And we've done that actually by setting up some action learning sets that are facilitated by the principal social worker, and they are each taking an area or a model where they want to know something a little bit more about. If it's something that's a bit more wider systemic, there's some work that's been done by York, actually local authority, that talks about how they're picking up evidence at a local level and how they're feeding that back into their commissioning cycles. So I think on the chat, our administrators put my email address on. So Natalia, if you want to just send me an email, then I might be able to answer it a bit more fully than I am doing now, but also link you up to other people that I know are looking at that. And from the meeting today, there's myself and Alison Milne, who's on this chat, who are taking forward some of the national work on this and trying to coordinate what we're doing. So I'll be able to link you into that as well.
Thank you. I know there is a query from Sam about, in the voluntary sector, can anyone recommend training about strengths-based approaches? I just wondered amongst yourselves if anyone's got any suggestions. Perhaps you could feed that into the chat, that might be helpful. And then I think we've had a few comments about concerns of carers being considered as an asset, and what about carers' needs and the support that they might need. So I don't know if anyone wants to comment on that.
I think it is something that comes up. It's come up obviously from workers within our local authority, but it's about that balance, sort of linking into what Sam was saying at the beginning. You know, we do want to encourage people to maintain their independence, but then yes, it's balancing what carers can do and support them with that. So it's, you know, carers do have a right to an assessment, so we do try and sort of ensure that we're not just saying, right, no, you're Mrs. Jones's wife, so you can help, or husband, or, you know, it's about supporting, but using the whole and the extended and the community. So it's a difficult one, and I can see where you're coming from, but we're not doing that. We're about sort of maintaining people's independence and then supporting the carer as a carer in their own right, so that maybe they can do their caring role because they're having support with another area, say like with domestic help or something like that, so that because they might actually want to take their mum shopping or take her out for tea twice a week rather than somebody else do that for their mum. So it's about sort of finding out what works for the whole family, not only the person that needs services, but their support structure around them as well.
Yeah, and I think, I don't know if I could just come in there quickly, because if you read anything about assets and then any conversation about assets, they tend to either be described as individual assets that somebody has, or family assets or community assets. Very rarely do you see the word assets associated with an organisational resources, and that's the balance factor that Rebecca's just been talking about. So whilst we've got this drive for strength-based working and trying to support strength-based working, there has to be a balance about what responsibility organisations have, because organisations themselves have assets and they are an asset.
Thank you. I'm aware that we're almost run out of time, but I have seen a couple of points about how can social workers in the NHS and integrated teams embed strengths-based approaches. Well, we're hoping that the quick guide itself might be helpful. Quite often, I think NICE is associated with health and it's regarded as a trusted source. So the fact that this is for social workers and it's about strengths-based approaches hopefully might help health colleagues understand what that means. And we're hoping that the example in the webinar about linking someone in hospital with their home community, thinking about how to connect them with relationships that are important to them, and thinking about what support they might need when they're discharged might also be helpful.
Yeah.
Anything else that anyone else wants to say about that? Because I know, Sam, you've had some thoughts about strengths-based approaches in health settings.
Yeah, in health settings. So the practice framework in the Northwest, we've got a small pilot going on, and Cheshire East is part of the pilot. And the other organisation that's part of the pilot is Salford Integrated Care Organisation, and their teams are actually multidisciplinary. So what we're trying to do is look at how we can adapt the practice framework and strength-based models that are used within that, within an integrated care setting where there are different professionals within that. So again, I mean, if that person who's noted that as a question, is it Karen? Yeah. If you want to drop me an email, and I can let you know what some of the discussions we've had with that about.
Okay, well, thank you very much, everyone, for your questions and for taking part. I'm sorry it's been a little bit rushed in terms of the questions, but our email addresses are on there, so if we can respond to any other queries that you have, do feel free to contact us. And thank you very much for taking part in the webinar. So goodbye, everybody.
Bye.
Bye.
Goodbye.